The topic that we prepared for you today is based on an illness that is becoming more and more of an issue in our country, and therefore we're going to see that more and more in the clinic with our patients as well. So we're going to start off with a few statistics. This illness is more prevalent in men than in women, and more men die of this illness every year than women. The highest prevalence of fatality is in middle-aged adults, and people in rural counties are nearly twice as likely to die from this illness as those in a more urban community. About 1 in 10 American Indians or Alaska Natives age 12 or older acquire this illness, as compared to 1 in 20 Caucasian Americans and 1 in 30 African Americans. Every day, 44 people die in the US because of this illness, and nearly 15,000 people die every year due to this illness as well.
So this is our case study. This is Corey. He's 27 years old. He was diagnosed at 25, but he started showing symptoms when he was 18. So now, since he's been diagnosed, his main impairments are he has brain injury, he's completely lost his vision, he has spasticity in all of his limbs, and he has impaired ambulation. He can't dress himself. He has issues with zippering, tying. He has issues using utensils to eat. He cannot drive. He now, at the age of 27, has to live with his parents, and he is only medically allowed supervised visits with his 4-year-old son. So this is Corey at 18, and this is him at 27 after his diagnosis. So we're going to show you a little video to tell you a little bit more about Corey.
Using 4 years ago when he was moody on Christmas Day.
My husband knew something was up, so my husband broke the door down and walked in on him with a needle in his arm.
What do you do to make sense of that when it's Christmas Day and your kid is shooting up?
You can't even make sense of it.
Corey lived but suffered brain damage. Once a high school pitcher, quarterback, and National Honor Society student.
Why?
It's not a Y. It's a V.
This is Corey now.
When you think about playing high school baseball and high school football, what are those memories?
They're good memories with good friends.
His troubles started with painkillers prescribed for a pitching injury.
And that little pill that made him feel better
Yes,
was actually the gateway to
it
heroin.
was. And then he went to Oxy, and then Oxy becomes too expensive. So that's when they go to heroin.
I mean, it's $5. It's the same price as a Happy Meal.
The heroin and prescription.
Sue and Lori were there when White House drug czar Gil Kurlikowski held a town hall meeting at the Taunton Firehouse last month.
The CDC has said an epidemic.
But before he could even finish, he was interrupted by a 911 call. Another overdose.
Anyone, you're responding to number 81 Oak Street.
Alright, so that video in itself shows how this is growing and how even in this small community in Taunton, Massachusetts, it's a growing issue. So some more statistics about this. In 2010, 1 in 20 people in the United States, ages 12 and up, reported using prescription painkillers for non-medical reasons in the past year. So it's growing in our society. Since 1999, the amount of prescription painkillers prescribed and sold in the United States has nearly quadrupled, making these drugs more accessible to younger adults, older adults, and as did deaths, they quadrupled from overdose. Enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for a month. So just think about that, being medicated around the clock for 1 month. All of us, plus everyone. Crazy. So 1 in 15 people who take non-medical prescription pain relievers will try heroin within 10 years. So Corey is an example of this common progression from prescription pain relievers to heroin over time. Drug overdose was the leading cause of injury death in 2013. Among people 25 to 64 years old, drug overdose caused more deaths than motor vehicle traffic crashes.
So now that we've heard all those overwhelming statistics, we have to ask ourselves, what is our role as PTs to assist in containing this issue and awareness of this issue? So the first is to utilize the biopsychosocial model, which focuses on our patients' subjective experience of their illness. So whether you're seeing someone for a neuromuscular condition or musculoskeletal, and you find out that they are a drug addict or have been a drug addict, they have this addiction, you need to be able to see their whole person. So it's a very comprehensive and collaborative approach to include all those psychosocial factors, because drug addiction does have many psychosocial factors that you want to be able to be aware of while treating those patients. You also want to be aware of the medications that your patients are on, whether you're an inpatient or outpatient, knowing if they're taking any new medications, if now they're taking those medications on top of the old medications, if they're getting new prescriptions. It might seem like it's a little bit out of our scope, but just ask them, oh, have there been any changes in your medications? Is something simple that isn't going to set up a spark in their mind that you are, thinking that there's an issue. It's just going to be a normal question that you're asking. Through the CDC's research, they found that obtaining overlapping prescriptions from multiple providers and pharmacies is one of the most significant risk factors for future addiction. So catching that in its early stages and recognizing that can make a significant impact for your patient and for their overall health and well-being. Going along with the biopsychosocial model, it's really about keeping up with your patients, providing support for them, and checking in with them every now and again about everything else. So that's just another part of it. The third thing is to recognize signs and symptoms. So there's psychological signs and symptoms, which include a change in personality or attitude. So, everyone has a bad day, so I'm not saying your patient comes in, maybe they're a little down on themselves one day. It's not, outwardly one reason to look for, but it's something to document, something to go back on and remember, so that in future situations, if that becomes more of a trend, it's something that could lead you to thinking that maybe they are abusing prescription drugs or any other kind of drugs. Any sudden mood changes, so during the therapy session, there's just kind of that snap, that's a major risk factor. Any aggressiveness, lack of motivation, anxiety without a certain reason, or even suspicious behaviors, which could include, if you're in an outpatient setting, them going to the bathroom for a long period of time. So if they're in the bathroom 10, 15, 20 minutes, and this is a constant thing that you're seeing, or if they say they need to go out to their car to get something, or they're constantly late, anything that would be suspicious that would throw you off.
So other symptoms include a sudden weight gain or weight loss, change in appetite and sleeping patterns, seizures that are unexplained if they don't have a history of epilepsy or any other seizure disorder, or if they have any coordination impairments, such as tremors, if they have coordination issues, or if they have slurred speech that's new and they haven't seen it. So if you see any of these symptoms, it's important to kind of ask your patient, where, like if they have a new bruise, and you don't know where it's come from, where did that bruise come from? I didn't see it yesterday. Or, saying, oh, you've been really sleepy, or have you been eating enough lately? You seem really tired compared to last week. Did something change? So that way you're not accusing them of anything, but at the same time, you're making sure you're checking in with them. You're making sure that everything's okay. And if they start getting really aggressive, if they have like a sudden mood change, or, if they give you an answer that doesn't make much sense, then you can talk to them in private and say, hey, I know you're on all these pain meds. Is there any chance maybe you've been using them more often than you need to? So you're, again, not accusing them of using something they're not supposed to, but maybe using it too often. And if they give you an answer, if they say, yes, I have been overusing them, or I'm using some other sort of drug, just telling them that you're there for them, and that the behavior that they're engaging in is very risky. It's a detriment to their health. And then also referring them, seeing if they've been talking to a psychiatrist, if their doctor's aware of this. So making that phone call of referral. And it's really important to make sure that you're supporting them through sympathy and warmth, and you're fostering their readiness for change. So
So you want them to know that you're there for them when they're ready to change, but obviously it's not in our scope of practice to treat drug addiction, so you have to make sure to talk to their medical care provider.
Okay, so why are we telling you all this? Before we told you that it was drug addiction, unless you looked at the screen, it seemed as if a normal impairment that would come into your clinic any day. And with numbers rising like this, it's going to be. This is going to be something that we're going to see if you're in the richest hospital in New York City, or if you're in a really poor community. You're going to see it. These people aren't criminals. They're our brothers, they're our sisters, they're the people who sit next to us in class, people who we play sports with. It'll happen to so many people. So it's just the fact that we need to expect that we're all going to see it no matter what setting we are in, and we have to be ready for it.
So we just wanted to end with a quote that we found from the Boston Globe from an article about heroin addiction we thought was really powerful. Everyone has been affected by this drug. It does not discriminate on the basis of race, social class, or even the way that you were raised.